There are many causes of bone and joint deterioration that necessitates the patient to have joint replacement surgery. The causes of bone and joint deterioration is usually could be divided into genetics and non-genetic causes. Genetic causes could be inheritance of osteoarthritis or rheumatoid arthritis, and the non-genetic causes could be variation of post-traumatic arthritis and as a result of an injury or any accident that the patient may have had during their life. The most common areas for the deterioration to happen is shoulder, hips, and knees, and the knee is the most common joint, and then hip and shoulder. Joint disease can medically manage. The typical management of joint osteoarthritis is modification of lifestyle, anti-inflammatory medication, physical therapy, and injections. And sometimes joint bracing can also help to unload the joint for better recovery. The time to consider surgery is when the medical management has failed. Usually, if typically the patient does not respond to medical management, then the pain becomes worsened, and that's the time when the patient seeks advice for surgical intervention. There are many joints in the body that can get replaced, such as shoulder, hip, and knee. The most common joints that usually is replaced is knee and hip, which is the most weight-bearing joints in the body. The benefits of joint replacement surgery is improve the quality of life. Typically, after these kind of surgeries, the pain subsides and the patient can resume their activity of daily living. The benefits of minimally invasive surgeries are typically faster recuperation, less pain, and smaller scarring. And that allows the patient to get to their activity of daily living faster than typical surgery. The recovery period for joint replacement surgery typically varies depending on the patient and the patient motivation. Normally, average time of recovery is about 2 months, 2 to 3 months. And after 2 to 3 months of physical therapy and recuperation, the patient can resume their activity of daily living.